Hi everyone, my name is Lisa Kerr, and this is my specialized population presentation. My population is centered around social workers in the genetic field. For social work class 684, medical social work. So what is genetic social work? Genetic social work revolves around helping patients understand, interpret, and supporting patients so that they can make informed decisions and understand their genetic diagnosis. Genetic social workers work within an interdisciplinary team, as most medical social workers do, which consists of a lead physician who specializes in genetics, a nurse practitioners, genetic counselors, and sometimes even a dietitian, depending on the patient's genetic condition or diagnosis. Genetic social workers operate from a biopsychosocial spiritual perspective, while also viewing their patients through a person in environmental lens. How is working with this population different? Genetic social workers in the past, specifically in the 1900s, used to solely operate as genetic counselors. However, due to genetic research and the changing of the landscape of the genetic field, the role of the genetic social worker shifted from being solely a genetic counselor to more so a supporting role. And now the genetic counselor has been introduced as its own role within the team. The launch of the Human Genome Project also contributed to the shifting or the advancement of the genetic field. The Human Genome Project was launched in 1990, and it basically gave this idea that testing human genes to further identify and map risk factors for genetic diseases. Genetic social workers also are distinguished from other populations of social work because they help families struggling with infertility issues. They also help newborns with screenings. They also consider predictive screenings for genetic dispositions. And lastly, they help patients with neurodegenerative conditions. Some of the challenges that genetic social workers are faced with is just the sheer difference of the research and how scientists go against create research versus how social workers approach research. So the beliefs around standard, rigorous research methodology and perceptions about important targets and changes may threaten collaborations. Ultimately, social workers operate from a different critical thinking lens. While they understand the medical lens, they don't necessarily always operate from the medical lens, nor do research in a quantitative way. Genetic health literacy issues and uncertainty also pose challenges within this field. Genetic risks are seldomly presented as definite, but more often presented as numerical ranges or in descriptive terms. Managing the challenges within this field. On a macro level, more education is needed on how incorporating a clinically trained social worker on the genetic team will better aid patients. Incorporating more social workers in genetic research can also help combat the issues that are in research. On the micro level, managing genetic uncertainty and communicating genetic uncertainty to patients through the following means: committing to lifelong learning, accepting/normalizing the fact that the field of genetics operate within a gray zone and genetics is not black and white. Strategies for communicating Strategies for communicating uncertainty for social workers in this field to their patients are obtain social support. Social workers should hold their vulnerability to patients and be honest. Social workers also should conform to the patient's needs and meet patients where they are at when they're receiving genetic diagnoses. And they should also focus on what is the concrete known information due to the sheer gray areas that come within genetics. Social workers also should interpret the genetic results with clients and advocate for them while also educating them on how to better understand the genetic information. What resources are needed? Patient-needed resources are genetic information interpretation. So patients need assistance interpreting and understanding the genetic information that's given to them, because it's usually given to them in a numerical way. Patients may also need emotional/mental support upon receiving genetic results. Patients may also need referrals to genetic screenings. Social workers often do interviews that obtain a lot of background information about patients, and based on what the social worker hears, the social worker can refer the patient to genetic screenings if needed. Patients also need advocacy from the social worker so that their voice can be heard to the rest of the medical team. What the social worker needs is proper genetic clinical training so that they can understand all the medical and genetic terminology. Social workers also need more of incorporation in genetic research. And social workers need integrated collaboration with the interdisciplinary team, and that need their role to be respected and appreciated. What sets the genetic social worker apart? The National Association of Social Work ethical standards help to set social workers apart from everyone else on the team. Interpersonal skills that social workers develop help set them apart as well. The cultural sensitivity, awareness, and competence that social workers usually have also help them be able to view patients in a holistic way. And the social science theoretical lenses that social workers use. That concludes my presentation on genetic social work. Thank you.